My name is Natasha Reynolds, a practical nurse from Davis Vocational College, and today I want to demonstrate how to take vital signs. First, you have to gather your supplies. So typically what you're going to need is the stethoscope with the blood pressure cuff, along with the thermometer of some type, a watch, and a pair of gloves with a disinfectant wipe to clean the items that are not disposable. Then what you're going to do is perform the hand hygiene to make sure your hands are clean before anything else. What is vital signs? Vital signs are an indicator of a client's overall health and a measurement of a client's body's most basic functions. What does include in vital signs? The things that are included in vital signs that I will be demonstrating today are heart rate, respiration rate, body temperature, and blood pressure. I will be introducing myself to the patient and explain what I will be doing today. Good afternoon, Mr. Sims.
Good afternoon, ma'am.
I will be doing vital signs. Is that okay with you?
Yes, ma'am.
So first off, we are going to start by checking the person's pulse. So we are going to use the third or fourth finger to check and make sure you don't use the big finger because a pulse is also in your big finger, so you have to use the two main fingers to measure the pulse. And the pulse rate is actually 60 to 100 beats per minute. And if the pulse is 100 and over, I would ask you to see the doctor immediately. Second of all, we're going to do the respiration rate. And the normal range for respiration is 12 to 120 breaths per minute. And normally we count the respiration for 1 minute, and then after we would get the amount of breaths per minute they take. So if the respiration is more than 20, I ask you to seek the doctor. So what we're going to do now is ask the patient to inhale and exhale so we can, for 1 minute, so we can actually do the reading. Next, we are going to use the thermometer. You don't have to use this. You can use the other thermometer of any kind, as I spoke earlier. So the normal range for temperature is 98.7 Fahrenheit to 98.9 Fahrenheit. So they are going to ensure that the patient's axilla, also known as the armpit, is dry before temperature reading is above 98.9 Fahrenheit. That means you have a high temperature, which leads to a fever. So I would ask you to see the doctor. What we're going to do now is measure the blood pressure. So the normal range for blood pressure is 120 over 80. Alright, so how to measure the blood pressure? You are going to apply the blood pressure cuff on the brachial and apply the stethoscope along on the brachial where the pulse is located. So after you get the reading, if it is above 120 over 80, that means your blood pressure is considered as high. So I consider you to seek the doctor. So that is it for today on vital signs, and thank you for watching, and thank you for being here today.
Yes, ma'am.
Okay, bye.